Barts Health NHS Trust Archives and Museums holds archives, artworks and objects which tell the story of nearly 900 years of healthcare in the city and East London. Our collections cover such a long time period, it's no wonder that we have some unusual items in our care. Here are a few that might still surprise you. President George Washington's teeth began to fall out before he turned 30. He had at least 4 sets of dentures made during his lifetime, and the Royal London Hospital Museum holds part of one of them. This is a fragment of an upper mandibular denture made by Washington's personal dentist, John Greenwood. The denture is accompanied by a letter from Washington to Greenwood, dated the 20th of February 1795, and enclosing $60 in payment. The denture is made of ivory, probably from a hippopotamus or walrus, and has an attachment for springs to keep it in place. So how did these presidential teeth come to London? There is a suggestion that they were originally held by the Baltimore College of Dental Surgery in Maryland, but were removed to London during the American Civil War, when Baltimore was threatened with capture by the Confederates. Washington's denture and letter then passed through various hands before being presented in this wooden frame to the London Hospital Medical College in 1911 by the orthodontist George Northcroft, who was a lecturer at the college's dental school. This pair of flintlock pistols date from 1780 to 1790 and were probably made by the gunmaker William Wilson. They belonged to the renter at St Bartholomew's Hospital, an officer whose job it was to collect rents from the properties owned by the hospital. As some of these tenants may have been more reluctant to pay than others, the renter carried pistols for his own protection. While the office of renter was only discontinued in 1912, these pistols had thankfully fallen out of use by that time. The famous cricketer W.G. Grace studied briefly at St Bartholomew's Hospital Medical College during the 1870s. By the time he qualified as a medical practitioner from Edinburgh in 1879, his career in cricket was well established. Grace ran his own medical practice in Bristol and employed locums to cover for him during the cricket season every year. This bat was autographed and may have been used by Grace in the 1880s. The bat was presented to St Bartholomew's Hospital as a gift by the surgeon Michael Bates in 1971 and was formally displayed in the hospital's W.G. Grace ward. These tiles originally decorated the bathrooms of the old south wing of St Bartholomew's Hospital, which was completed in 1740. They are Bristol Delftware manganese tiles, which were probably made in Southwark or Lambeth. These tiles depict various fishing and sailing scenes, and there are others in our collection which have a floral design. The tiles were removed in the 1930s when the south wing was demolished to make way for what is now the King George V block. You might wonder what a piece of stonework from a medieval priory is doing in a hospital museum collection. It comes from the Priory Church of St Bartholomew the Great, which was founded as an Augustinian priory alongside St Bartholomew's Hospital in 1123 by the monk Rahere. While much of the hospital survived the dissolution of the monasteries, the Priory Church was dissolved in 1539, and the nave of the church was ransacked and demolished. Barts the Great was rebuilt and restored in the 19th century and survives today as London's oldest parish church. This stone from the original priory was discovered in around 1950. We hope you've enjoyed this video. We'd like to hear about your favourite item in the collections. You can search our online catalogue via the link below and follow us on Twitter and Instagram to tell us what you find.